Thank you for viewing this educational presentation. This module discusses a test of bladder function called Urodynamic Studies. To understand how urodynamics work and why we do them, let us first discuss how urine is handled by the body and how the bladder normally functions. Urine is produced by the kidneys and travels through tubes called the ureters to the bladder. This illustration shows the male anatomy of the pelvis from the side, revealing the bladder, which is a muscular pump, as well as the urethra, which is the tube that urine flows through to the outside of the body. In a man, the urethra normally travels through the prostate. The bladder has two important roles in handling urine. It must first store the urine that comes down from the kidneys, and then it must completely empty that urine and expel it from the body. Urodynamic studies evaluate how well the bladder performs these two roles. This illustration shows the physical differences between an expanded full bladder and that of a smaller emptying bladder. The full bladder is storing urine, while the emptying bladder is releasing urine out of the body. For the bladder to function properly, three different components must work normally: the nervous system, including the brain, spinal cord, and nerves to the bladder, the bladder itself, and the sphincter or urinary control muscle. The sphincter is a muscle that squeezes around the urethra. It is closely associated with additional muscles referred to as the pelvic floor muscles. Malfunction of any of these components can lead to a variety of bladder difficulties. Now let us examine the two roles of the bladder in more detail, beginning with storage of urine. A normal adult bladder should hold about 500 milliliters, or 2 cups of urine, and normally we empty this volume every 3 to 4 hours. In order to store properly, the bladder muscle must stay relaxed as it fills with urine. Any contractions or spasms of the bladder muscle as it fills leads to a sensation of sudden urgency and difficulty controlling the bladder, and this is called an overactive bladder. The bladder wall must also be able to distend easily, like a thin-walled balloon, as it fills with fluid. A thicker or tougher bladder wall will also cause more frequent urination and control problems. Finally, as the bladder fills, the sphincter and pelvic floor muscles must squeeze around the urethra and keep it well supported in order to prevent urine from leaking out during sudden coughs, exercise, or other increases in abdominal pressure. When the bladder is full, the brain will signal when it is appropriate to empty. Even when we are bursting at the seams, most of us can exert enough control over the bladder and sphincter muscles to prevent urinating until we can get to a toilet. When we are ready to urinate, the first thing that must happen is relaxation of the sphincter muscle, which must be complete and sustained as the bladder empties. To empty, the bladder muscle must contract properly. And finally, the bladder and sphincter must be coordinated with each other during this process. Otherwise, emptying will not be complete, as the sphincter muscle inhibits the flow of urine out of the bladder. Problems with bladder function will typically lead to one or more of a few common symptoms. These include abnormal frequency of urination, where you have to go all the time, abnormal urgency of urination, where you have difficulty holding your bladder to get to the toilet in time, leakage of urine, called incontinence, and difficulty emptying the bladder, called retention of urine. For each of these problems, there may be many different causes. Successfully treating the condition depends on properly determining the precise cause. To do this, urodynamic studies may be required, and in many cases, they are an invaluable tool in sorting things out. Other tools or tests used to understand the cause of bladder symptoms include medical history, physical examination, including a pelvic and/or rectal exam, a bladder diary or voiding diary, laboratory tests, and ultrasound. Cystoscopy is another test where a small telescope is inserted into the bladder through the urethra, allowing a direct inspection of the inside of the bladder. Urodynamic studies are not required for all patients with bladder problems by any means. Some of the more common reasons why urodynamic tests may be requested include when conservative treatment and/or medications fail to resolve a problem, when a problem is complex and a precise diagnosis is required, when surgery is planned or being considered, problems after surgery, and in neurologic conditions affecting the bladder. The concept of a urodynamic test where small tubes are passed into the body may be intimidating or distasteful. However, it is important to note that it is not a painful procedure, and the results of the test are very valuable to your doctor in helping him or her to help you. There is little risk associated with the urodynamic procedure. Bladder infections rarely do occur afterward, but antibiotics are not routinely used for everyone. Having said that, if you normally take antibiotics with dental work or have a history of rheumatic fever, artificial heart valve, heart murmur, or recent placement of a prosthetic device, such as a coronary stent or artificial hip, then you may require antibiotics prior to the procedure. Drinking plenty of fluids after the procedure will reduce the risk of infection and also help to clear the little bit of blood you might see afterwards. Typically, a urodynamic study takes approximately 30 to 60 minutes to complete, and is usually done by a nurse or technician. A doctor may also be present for some tests. There are two types of urodynamic tests: video urodynamics, which involve the simultaneous use of X-ray pictures periodically through the procedure, and non-video urodynamics, which do not. In preparing for your urodynamic study, there is little you need to do. However, it is helpful to review the following checklist. If you have collected bladder diaries, where you keep track of your urinary frequency and leakage episodes, bring these with you to the test. As with any medical appointment, it is also helpful if you bring your medication list, including the dosages. Take your usual medications on the day of the exam. An exception to this may be your bladder medications if you are on any. These medications should be reviewed with the nurse or your doctor to determine whether or not you are to stop them beforehand. It is important to advise the nurse or your doctor if you normally take any antibiotics before procedures, such as dental work. Also let them know if you have any concern that you might have a bladder infection at the time of the procedure. If you have a neurologic condition, it is important for the staff to know what that condition is and if you need assistance transferring from a wheelchair. Finally, some patients with neurologic problems get headaches or sweating when their bladder gets too full. If you have experienced this, please let someone know. On the day of your procedure, eat a normal meal, move your bowels as necessary, and try to arrive to the exam with a comfortably full bladder. This may be difficult for some patients, of course, but as best as possible, try not to empty your bladder for a couple hours prior to the test. If you're finding it difficult to hold your bladder and are bursting at the seams when you arrive, let the staff know so that they can have you urinate on a special toilet rather than in the public washroom. The urodynamic study begins with an interview with a nurse, technician, and/or doctor. The procedure will again be explained, and a review of your medical history and bladder condition will be undertaken. You will then be asked to change into a hospital gown or similar attire and will be taken to the urodynamics room. This figure shows a typical basic urodynamic suite. There are many different setups available. There are two parts to most urodynamic studies: a non-invasive uroflow test, where you simply urinate into a special toilet, and what is called the Multichannel study, which is done with catheters in place. If you are normally able to empty your bladder on your own, you'll be asked to do so into a special toilet. This is called a uroflow test, and it measures the rate, volume, duration, and pattern of urinating. It also gives the staff something to compare to when you later have to urinate with a catheter in place. After urinating, the nurse will determine how completely you emptied your bladder by passing a small catheter into it or scanning it with an ultrasound machine. This is called a residual volume assessment. The second part, a multi-channel study, is further divided into 2 or 3 parts to examine bladder filling and emptying. All of this can be done with or without X-ray. When X-ray is used, the study is called a video urodynamic study. This illustration shows a typical Uroflow Commode Chair. To begin the multi-channel test, you will first be positioned onto a special bed or chair. Then a tiny catheter will be passed into the bladder. Another tube with a soft balloon will be placed into the rectum to measure pressures in the abdomen, which affect the bladder. Finally, electrode stickers may be placed onto the skin near the anus to record muscle activity of the urinary sphincter. While it may not be pleasant to have these tubes placed, it should not hurt, and any discomfort will be minimized if you are able to remain as relaxed as possible during this time. Once the catheters are positioned, they are connected to a computer, which records the pressures in your bladder and plots out a graph. You may then be repositioned on the chair or table, or you may be asked to stand. If you are having a video urodynamic study, an X-ray machine will be positioned in front of your bladder. Once you are set up, your bladder will be slowly filled through the catheter with sterile water for a non-video study or contrast solution for a video study. As your bladder fills, the computer will measure pressure changes in it, and you will be asked to report various sensations, like a feeling of fullness, an urge to urinate, and when you cannot hold anymore. This part of the test is referred to as the filling cystometrogram. If part of your bladder problem involves urine leakage or incontinence, then during filling you will be asked to bear down or cough to bring about this leakage. The nurse will try to record the pressure at which leakage occurs. While this may seem a bit unusual or embarrassing, it is important for the study to try to reproduce what happens at home. Sometimes at the end of bladder filling, the tube in the bladder will be pulled back to measure pressure in the urethra. This provides a measurement of the strength of the pelvic floor and urethral sphincter, and the ability of the urethra to close off and prevent leakage of urine. This part of the study is called a urethral pressure profile. Once your bladder has been filled, you will be asked to urinate again into a special toilet. This time the small catheter may be left in the bladder, and you will urinate around it. While unusual, this is actually easier than you might think. Again, X-rays may be taken while you urinate. This part of the exam is called a pressure flow study. Following the procedure, you can resume your normal activities. It is important to drink plenty of fluids afterwards, as this will help to clear any symptoms of burning on urination or blood in the urine. Rarely, it may be necessary to see your doctor after a urodynamic study if there is significant bleeding or burning with urination that does not clear quickly, or signs of a serious infection such as fever, chills, or pain in the flanks. To conclude, urodynamics are a safe and well-tolerated procedure. They are an extremely valuable tool to assess bladder function, and they can provide information about your condition which can lead to more effective treatment. Thank you again for viewing this educational program.